St Vincent's standing by.
This is St Vincent's Hospital, one of the busiest emergency departments in Australia.
Nikki, you're going to scry? Yeah.
Came to triage having vomited and then had a tonic-clonic seizure.
Mate, relax, relax.
He has slashes to his left shoulder.
Minutes away from Sydney's pumping city centre, the entertainment hub on Oxford Street, and the famous King's Cross Strip. The ER sees people from all walks of life. Tonight, a midnight stroll ends in trauma.
He went for a walk and unfortunately has gone over a cliff.
Making the tough calls.
I'm about to ring a woman and tell her that her husband's not coming home.
And the ER team makes a last-ditch effort to save a young man's life.
So this guy is really pale and shut down and sweating. Classic features of a person who's trying to die.
It's midnight in King's Cross, and the nightclubs are going off. With the drinks going down and the party mood winding up, the last thing anyone expects is to end the night in St Vincent's emergency. Emergency staff specialist and mother of two, Dr. Iromi Samarasinghe, starts her night shift.
I like emergency because it's very frontline. You deal with fixing things that are acute, critical, sort of life-threatening things. It is a bit of an adrenaline rush, and working at St Vincent's is quite a different story from being a housewife and mother back in the suburbs.
Iromi's skills are about to be put to the test as nurse Rachel Tilley takes a call on the bat phone.
26-year-old gentleman who has been in a nightclub in Potts Point and has been reportedly stabbed to the left side of his chest. You've got heart, lungs, a lot of major vessels there, so you can bleed out very quickly.
It's a code crimson, which means all relevant staff to the resus bay. Emergency medicine doesn't get any tougher than this.
Nikki, you're going to scry? Yeah. Yeah. I just got to get that side down.
Ready? 1, 2, 3, go.
Okay.
Hello? How are you going?
So all we know about him is he's got a stab wound to his left thorax there, and there was a significant amount of blood pooling around him on the bench he was lying on.
So this guy is really pale and shut down and sweating. Classic features of a person who's trying to die. He's not getting any circulation to any of the rest of his body. He's keeping that circulation just to his heart and his brain.
Can you get a litre of Hartmann, just run it through?
The doctor is supporting his airway and providing 100% oxygen to try and improve that circulation.
Just put it back there before doing anything else.
He's a young man with a single stab wound, which is most likely in the heart, and it's a time-critical injury that needs to be explored in theatre, and that wound needs to be closed. Otherwise, he's going to just hemorrhage into his chest cavity, and he will die here.
It's cardiothoracic fecal. And find out who the consultant is.
We need to put a chest drain on.
Yes.
Isaac's blood pressure is plummeting, and he's still bleeding out.
120 mils, Nikki, in the chest drain. It's all right, Isaac. You're in hospital now.
It's all right, mate.
Isaac, you're in a hospital.
Still bleeding.
Tony's going to do the airway.
It's not clear if the bleeding is in his heart or his lung. The team need an ultrasound to pinpoint exactly where the knife went in.
Have a look at it.
Is this the pericardium?
That's a pericardium. Underneath is the that's the heart, and that gap in between.
Look at this ultrasound. You can see that there's a dark area around the beating heart muscle. There's blood in the pericardial sac, and it shouldn't be there. So we assume that he's punctured his heart.
It looks like a hemopericardium.
The knife has gone straight into the left ventricle, and there's blood leaking from the ventricle into the sac. When that sac fills up with blood, the ventricle cannot contract anymore. So there's no way of getting blood out of the heart to the rest of the body.
We need to drain that.
Okay, well, the cardiothoracic guys are coming in.
Isaac needs to go into surgery immediately. He needs to have the blood around his heart drained and the wound closed up. But the cardiac surgeon is still several minutes away. But Isaac may only have minutes to live.
Is he on his way?
He's on his way.
Well, how long does it take? And give me the prop.
The surgeon directs the team by mobile phone. He wants them to do a complex procedure called a pericardiocentesis. A needle is inserted into the pericardial sac around the heart to drain away the excess blood.
It's very rare that you need to do a pericardiocentesis, and you leave it for that last ditch effort when you know the guy is about to die.
We have to do it.
He wants us to do
Who?
cardiothoracic registrar.
How long does it take him to get here?
He won't be quick enough to save it. We need to do it.
Okay, let's give me the prop.
I have to do my best, but his blood pressure's already in his boots.
They begin the risky procedure. It's Isaac's only hope.
Just to get a big needle and attach it to the biggest syringe that we've got, the biggest one of these, like a 60 mil, and then just aspirate one after the other.
By putting a needle directly into the pericardial sac, drain some of that blood and relieve the pressure on the beating heart.
Isaac's blood pressure is fluctuating so much that they may need to do chest compressions to keep his heart beating.
I'm going to start compressions now. Or do you want me to hold on?
Hold on, his blood pressure's okay for him.
All right, keep
I think
good
so. You know, he's a young bloke. He'll cope with 74.
All right.
Yeah?
The cardiothoracic surgeon arrives. He quickly gauges Isaac's chances of making it to theatre alive.
Despite the decompression, his blood pressure still has only been 50 to 60. We can try. We just have some more aramine, guys. Do you want to just see if they're ready for us upstairs? If they're not, we need to do it. That's right. So
We may well be opening the chest right.
If they're ready upstairs, we're good.
The reason we are preparing to do a stenotomy here is because he is so close to death's door.
Coming up, doing the hard yards in ER.
We see patients, you know, who are very unwell and patients who die, and yeah, it does get to me.
The ER team are desperately trying to keep 22-year-old Isaac alive after he was stabbed in the heart at a nightclub. It has taken a team of over 30 medical professionals to keep him from bleeding out. His condition is so critical that they fear he may not make it to the operating theatre alive. They prepare to do heart surgery in the resus bay.
Okay, we're opening here, and we're doing chest compressions very shortly.
The best place would be in theatre. It's got the right equipment, the right degree of cleanliness. This is not the place for...
We have a bucket of betadine.
And the drugs, I need the 500 of fent pretty fast because he's about to cut. Like 300.
All right, guys.
500
fentanyl. All right. Anyone who's not essential needs to step out now.
While they're prepping Isaac for heart surgery in the resus bay, his blood pressure improves slightly.
500.
His blood pressure's better?
Yeah, aramine.
The surgeon seizes the window of opportunity to take Isaac upstairs to the operating theatre, where his chances of survival will be greater. The odds are stacked heavily against him, but the emergency team have done everything they can.
I've been out to talk to the family and I've told them to expect the worst because it's a critical injury and he's incredibly unstable. And I couldn't be sure how long the surgery would take. And I'd warned them that it could be several hours. So the family are going to wait up in intensive care for him.
Isaac's life is in the hands of the surgical team.
Even if you don't get it right, you know at least you've tried. And that's the whole point, that you're willing to use your training to have a go and try and make a difference.
St Vincent's emergency department sees 42,000 patients a year. The staff need to think on their feet and work at a cracking pace. Emergency Dr. Kate Sellers is here for the long haul.
Have you ever had this sort of pain before?
I've been here nearly 9 years now. I'm one of the senior registrars.
St Vincent's is a major teaching hospital. Part of Kate's job is to mentor the younger doctors.
When you touch the rib, do you put the chest drain just above the rib or just under the rib? Above the rib. Above the rib, correct.
Despite her wealth of experience, she is still learning.
I'm training to become a specialist in emergency medicine. That specialisation process can take about 8 years of training once you've already been through medical school. Can you sit up forward, please? I'd love to. OK, no talking for a minute. Have a lie back for me. One of the great things about this job is coming to work and having no idea what's going to roll through the doors. How are you going there, Brian? You with us? Some days are so chaotic. Things can change in a heartbeat. You can be sitting down thinking, oh, what a lovely day is this, and then all of a sudden the bat phone will ring, and just as you hang up, the bat phone will go off again, and you think it's some mistake.
OK, thank you. St Vincent's copy clear.
Hello, it's Katie, the doctor looking after you. It's an awesome feeling to save someone's life. Just pop the drain in the left side of your chest. If you have a really good resuscitation, you bring someone back, who was clinically dead, then it's high fives all around. The high that you get from that will completely overshadow, the lows for the next 2 weeks.
But not all days are high five days.
We see patients, who are very unwell and patients who die, and yeah, it does get to me. It's funny though, sometimes it's the small things that get to you. I remember one patient came in having a cardiac arrest from a shopping centre, and we worked on him for half an hour and couldn't revive him. And I went to find his wallet to find the next of kin details, and his wallet was in a shopping bag that had a roast lamb and potatoes and broccoli, and I looked and I thought, this old guy's just gone to the shops to go home and cook a roast for his wife, and I burst into tears because I thought, I'm about to ring a woman and tell her that her husband's not coming home.
At the end of the day, it's the teamwork that keeps Kate going.
To me, emergency most time rewarding session, there's really a forefront there because it's, I think, it's exciting to be people at the worst and know that we might do this.
It's down in the ER. Registered nurse Brendan Clifford gets a call on the bat phone. It seems a midnight stroll after a party has ended in trauma for a 34-year-old man.
The ambulance had just phoned saying they've had an intoxicated man who's fallen 5 metres off a cliff. He's injured his leg, so the mechanism's quite dramatic, so we're setting up as a major trauma. Right leg injury. GCS has dropped after 15 of more from one of my dad's. Getting ready to give her some analgesia to immobilise fractures, because it sounds like it might have a bad fracture of his leg.
This is exactly what Brendan signed up for when he came to St Vincent 4 years ago.
One of the great things about nursing in emergency is that every day is different in these cells. Another day out at triage, another day at the subacute cubicles. It's the mixture of that kind of nursing that makes the job really good. The pace of work is quite good, so you're constantly being challenged.
How far are they away?
10 minutes away.
Okay, so I can do this.
In a major trauma case like this, where there may be broken bones, the paramedics need to move slowly.
So when we got there, he was just complaining of pain in his hip and nowhere else, and I explained to him that because he had been drinking that he might have hurt his neck because of the height. So we collared him. He had the pain in his hip from the moment he hit the ground. So taking your pants off. We're not querying that he had a loss of consciousness. Really cold and saturated. The cliff was pretty wet.
Thank you very much. Thanks a lot. Hello.
No allergy.
How are you going? How old are you? 34. Do you know where you are at the moment? In the hospital. Do you know what the year it is? 2011. Do you know which month it is?
The man has been given morphine and midazolam for the pain in his leg, but he's still conscious.
Now, do you know what happened to you?
Yeah, I slept and I fell and I'm very sore.
Slept and fell. Where are you sore?
On my hip, I think it's the major area.
Sorry?
On my hip.
Your hip. Okay. Did you bump your head?
I'm sure, yeah.
You did bump your head?
I think so.
Do you lose consciousness?
Maybe.
You're not sure?
Dr. Farzad Jazayiri still can't rule out the possibility that Andrew may have hit his head on the rocks when he landed. He needs to make sure there's no underlying injury that could potentially be life-threatening. Coming up, an extraordinary story of survival against the odds.
It's very scary. Hope I never have to do it again in my life.
The ER trauma team are treating 34-year-old Andrew, who came to grief on the rocks after a beachside party.
He went for a walk and unfortunately got a little close to the cliffs and has gone over a cliff.
Any recreational drugs?
No.
Tonight? No. Nothing. And how much you been drinking?
General Saturday night beers.
Farzad is trying to determine his mental state to rule out the possibility of a head injury.
And do you know why you had the fall? What happened you had the fall?
Just walking along and I think I just lost my footing and then off I went.
Yeah.
Satisfied that Andrew has all of his mental faculties, Farzad continues his investigation.
Can you take a big breath in for me and out? No pain? Can you feel me touching you? Yeah. Okay. Push me away. Away. Okay. Towards your head. That's fine.
Farzad does an X-ray of Andrew's right leg and hip. The problem soon becomes apparent.
Oh.
Yep.
Andrew's wife Erica arrives to hear the prognosis.
Okay. There's this long bone. The head of the long bone sits in the pelvis, and that head is broken from the bone itself. It needs operation.
It needs an operation?
Yeah, it will need an operation. They just replaced that head. They put a prosthetic head there.
He needs a hip.
Hip replacement, yeah.
So what we do in the meantime is make sure his pain control is good, because it's quite a sore fracture, and the orthopedic specialists will come and review and come up with a plan for him.
For Erica, the news is bittersweet.
I feel absolutely terrible, but I'm more relaxed now I know that what it is. It was not knowing that's worse.
I think I was very lucky, yeah. It was one of the things that crossed my mind when I was in the ambulance, actually, that had there been a higher tide, could have been a totally different scenario.
I think he'll do fine. I think he'll probably stay away from cliffs for a little while.
It's a quiet Sunday morning in the ER, and Dr. Kirsty Short is checking up on one of her patients when a familiar face turns up in the resus bay. It's Isaac Parry, the man who was fighting for his life in this same resus bay 10 days ago with a stab wound to his heart.
What happened at the time is that there was a puncture to his left ventricle, but he's come back now with increasing shortness of breath. One of the things we need to rule out is whether or not there's a return of fluid collection around the heart in that area where it collected initially.
Isaac's partner Hannah has brought him in. Kirsty immediately does an ultrasound.
See where this black area between the two areas of white? So that's the heart. It looks like there might be a suggestion of a small layer of fluid around there. So what we'll do is we'll have this. Might probably something that we're going to need to do something about. Okay. So to actually do some sort of drainage procedure for that. Okay. What we'll do, we're going to get the cardiologists to come and have a look at him. I know you've been through the mill recently, haven't you?
Drainage.
We're going to get the cardiologist. So the next step is that we'll get a formal echo, so a formal ultrasound of the heart, so they can define exactly where that fluid is and how much is there, and then they can advise on what we need to do in terms of drainage or more definitive treatment for that today.
After the trauma Isaac has already been through, this is disappointing news. Dr. Raul Santram reassures him.
At this point, it's the best place for you to be, okay? Yeah. You don't want to fall sick at home and then, you know, hopefully whatever it is, we're getting it right at the start so that you don't become, you know, worse, and then you're in bigger trouble, you end up spending more time in hospital. Okay? So you did the right thing in coming in.
Trouble is the last thing Isaac needs after the incident that is still painfully fresh in his memory. It all started in a nightclub where he does casual bar work.
Yeah, I just went in to pick up my pay and, you know, have a few drinks, and left in an ambulance. It all happened in about 2 seconds. Just noticed a waterfall of blood, and I think my girlfriend sat me down on a couch, and I think I pretty much bled out in the club. And
Isaac owes his life partly to Hannah's quick thinking.
I think she was trying to stop the bleeding while trying to unlock someone else's phone to call the ambulance and that as well. So she never left my side while I was in ICU and intensive care and that.
It was very scary. Hope I never have to do it again in my life.
That looks good.
The cardiologist does another ultrasound to investigate the fluid that has developed below Isaac's heart since his operation.
But now it looks all right. Yeah, this is the sound of blood rushing through the valves of the heart.
What we are suspecting is a little infection between the lung and the chest wall. It's too small at this point to be drained, but we will start some antibiotics. He will be admitted to hospital under the care of one of our cardiologists. The cardiothoracic guys who operated him will have a look at him too. Hopefully, he improves in the next couple of days and, back to his life.
Isaac can remember the life-saving procedure in the ER.
Apparently, it was done, when I was on the brink of death. There was no time for any painkillers or anaesthetics. I do recall sharp pains, sort of in different intervals, building up my body. One of the surgeons was a female, and I only remembered her voice. She had an amazing voice, sounded like an angel, and she just kept talking me through, like, we're doing this, and it's gonna be okay, Isaac, okay, we're gonna do this now, and how's that, and just sort of, I'm sure my eyes are probably shut and might not have had much of a heart rate, but I remember her voice, and it's probably what, might have been what got me through.
Isaac may be in for some more tough times, but he's not about to let this setback get the better of him.
Alive.
Next time on King's Cross ER, an overdose in the hospital toilet.
Look at me. Open your eyes.
And while one marathon runner burns,
41 degrees is way too high and way too hot.
another one's heart stops for 6 minutes.